Thank you so much for joining today, Dr. Nancy McWilliams. I originally found about you through your paper on some thoughts on schizoid dynamics. That was quite a long time ago. But what really struck me about that paper was your clarity and understanding of schizoid personality or schizoid dynamics from this perspective. So maybe would you like to start introducing yourself and what you do, and then tell me a little bit more about your interest in schizoid personality?
Let's see. I'm a psychoanalyst and psychotherapist, a psychologist. For about 40 years, I taught at Rutgers University's Graduate School of Applied and Professional Psychology. I've just retired from there this past summer, but I still do a lot of teaching internationally. When my teaching caused me to realize we needed some books in the field on personality structure and its implications for therapy. And my students actually pushed me to get my thoughts down in book form. And somewhat to my surprise, they were not just useful in my own country where I knew they were needed, but they were translated into a lot of other languages. And that has allowed me to talk with therapists all over the world about different kinds of personalities. So I'm basically a clinician. I'm not a researcher, but I'm very interested in individual differences and have been all my professional life. Have written a lot about them, not just different organizations of personality, but what it means for psychotherapy if your patient, is a trauma survivor or a twin or has an ongoing illness or was adopted as a child or is from a different culture. That kind of, it just interests me adapting to other people's individuality.
Mm-hmm. Right. So you've been interested in this individual differences and the adaptations such individuals make.
All my life, yeah. And I think one of the first important personality differences I recognized was that people with schizoid psychology see the world quite differently from the way that I see it. My own psychology is more in the hysterical and depressive realm, which means that if I'm upset, I move toward people. I tend to see people as sources of comfort. I'm pretty extroverted. And when I had patients who were schizoid and they were upset, I tend naturally to move toward them. Yeah. And I had a supervisor who described his own personality as schizoid, who said, back off. This person needs a medicine because he's been overeating and you're trying to feed him.
Right.
And it was the first time I really got that some people feel better if you give them more space rather than if you move in toward them. And so I also had there were several people who were important influences on me who saw themselves as schizoid, and they described to me what it was like to be them. I think one of the things about my own personality is I was never shamed. And so I am not judgmental of other people. And I think people pick this up. I'm very curious about them. I'm not trying to classify who's sick and who's well.
That's what was visible in your paper as well, because I've noticed there is a lot of misunderstanding on the internet, especially when it comes to schizoid personality. And DSM and all these diagnostics, that they tend to focus on very superficial details, on just what is observable, rather than the internal world of a person, whereas you seem to capture that internal experience.
Yeah, that is a problem of the way we've decided to categorize people for, psychiatric purposes. If you limit it to only what you can observe and measure and count, you aren't going to elicit from people what it's like to be them. And in a psychiatric compendium, you're also going to put the emphasis on the maladaptive aspects of any kind of personality, when in fact, all kinds of personality have very adaptive features too. And they're not disorders, they're just personalities. You can have a personality that's so inflexible or primitive that it is a personality disorder. But
right.
Everybody's got a personality. And you can name it according to some of these terms that have arisen to try to understand individual differences, like whether they're more obsessional or more depressive, more narcissistic. And these terms aren't necessarily pejorative, but in the Diagnostic and Statistical Manual, they sound pejorative because they are describing the maladaptive end of a continuum.
Yeah. So would you say that also could imply that you could categorize these personalities as healthy and unhealthy? So
well, I
let's
think
say
like every other kind of personality, there's a range from very high functioning, healthy people with that personality to pretty crazy people with that personality.
Yeah.
The personality itself is not a disorder. It's just a style.
I do agree. So in this context of schizoid personality, in your opinion, how would a healthy schizoid look like? I'm only asking is because of my background. I'm a coach. I'm mostly working with, let's say, higher functioning people, and I focus more on helping them to, make the best out of their life. I don't provide treatment or,
Well, relationships are difficult for schizoid people. They tend to feel easily overstimulated, sometimes irritated by too much closeness. So to be able to make a relationship in which they feel they can be themselves and feel understood would be a high priority. Schizoid people often get disillusioned with other people. Especially when other people are defensive in ways that schizoid people are not. And so they withdraw. So I think a person at the healthy end of the schizoid spectrum would be able to use their sensitivity, their tendency toward introversion, their emotional honesty, and their intensity in positive ways. A lot of artists and philosophers and scientists and other people who are in creative professions that often involve some isolation, a lot of them are pretty high functioning schizoid people. Albert Einstein, when you read his description about himself, he talks about how peculiar it is that he never felt he was really deeply close to or identified with other people. He talks about he never had a team he was rooting for. He didn't see his country as the only place to feel patriotic toward. Groups, he always felt a little bit like an outsider. But he was able to use that tendency to be all alone and to think a lot and live a lot inside his mind in extraordinary ways. And he was a very pleasant, loving person from everything I understand about him. Very
Yeah.
warm, but
Yeah.
quirky. Most schizoid
Yeah.
people are a little bit quirky, and it's partly to keep other people a bit at a distance. You know,
Yeah.
if you're going to try to be my friend, you have to take me as I am, and I'm a little bit different from most people. Is kind of the message. It's a way to screen out people who are too superficial.
Mm-hmm.
So, like Einstein had that crazy hair, especially for the time. Uh,
Yeah.
it's an interesting thing has happened to me ever since I wrote a book on personality differences. I often get comments from readers that they recognize themselves in a chapter, or that one of my chapters very well describes a patient they had. But the only people who thank me are self-diagnosed schizoid people.
Interesting.
They send me thank you notes. They send me emails. I finally feel understood. It's very touching. And so when that happens, I tend to ask people to say more. Tell me about your own psychology. So I've been collecting um, stories from schizoid people about how they manage their tendency to be too easily overstimulated, impinged on, intruded upon, suffocated, smothered. Some of them, wear a coat no matter what the weather. Some
Yeah.
of them, it's very common if they're in a class for them to sit closest to the door. Um, there are all kinds of other adaptations they make to their own personality. They go into a closet, they go out into the country by themselves. Some of them rock when they're overstimulated. So it's been very fascinating for me. The reason that I wrote the article that you read was that having written a chapter on this and gotten all of this responsiveness,
Yeah.
not just from readers, but from like friends and colleagues who read it as well, who began telling me what they resonated to. It just increased my knowledge base about what it's like to have this kind of psychology. And as
Yeah.
I get older, I find that part of myself too. I think Carl Jung was right that we all have some of everything. We all have the opposite. And so I'm kind of obviously extroverted, but I'm also deeply introverted and solitary in certain ways. And I've been more in touch with that part of myself as I get
Through
older.
through that research also through that research on schizoid and learning more about it as well, I would imagine.
Yeah, yeah. It's been very rich, these conversations with people who feel that I'm not going to pathologize them so they can tell me what it's like to be them.
Yeah. Yeah. So so I've noticed that you see the kind of centrality of sensitivity in schizoid
Yes.
personality. Where do you think it's coming from?
I think a lot of it is genetic and temperamental. We know that children differ from one another from birth on a whole lot of um, areas. Uh, as early as the 1930s, um, some very observant psychoanalytic people working with children observed that although most babies, if you hold them, they cuddle up to you and they snuggle in, but a minority of babies stiffen up and pull away as if they're a bit overstimulated.
Hmm.
And I think that's the group that, I mean, some of them are probably on the autistic spectrum, which is a different internal psychology from schizoid. But some of them are schizoid, and they do want the closeness, but it feels like too much.
Yeah.
to them very easily.
Yeah.
So yeah, I think a lot of that personality has to do with sensitivity. I think one of the reasons that people with schizoid, you heard me say this in the article that you referenced, but one of the reasons I think they're often attracted to people with hysterical psychologies and vice versa is that both of those types of personality are highly sensitive. They manage their sensitivities in different ways, but they
I see.
recognize something in each other.
I see. So the hysterical or the depressive part, that would be something more unconscious for someone with schizoid personality, something they are not fully in touch with.
Yes, although interestingly, Harry Guntrip, who was the greatest theorizer of schizoid psychology, used to comment that inside every schizoid person, there's a hysteric and vice versa. Um, so that intrigues me. It fits my own experience, just as a human being, but also as a psychotherapist.
Right. I just started thinking how would that, because I'm thinking a little bit in this Jungian terms. So how would that shadow, that hysterical shadow, come out of a schizoid, and in what ways, in what kind of situations? I don't know if you've had any experiences of that.
Well, for example, I know a couple of men who think of themselves as schizoid, who are quite seductive,
Mm.
and they don't really see that they are. You know, they do the same thing that female hysterics with whom you're more familiar. That who me? I was just saying what was on my mind. You know, uh, you can see that in some schizoid men, that uh, interest in sexuality and gender, and as a
Right.
kind of organizing set of thoughts. But it's not the primary thing. The primary thing is I'm keeping my distance here.
Right. Right.
They
Interesting.
often evoke um, in uh, people who are attracted to them a tremendous sense of idealization and attraction. You know,
Hmm.
like the schizoid singer, you know, who writes beautiful lyrics and delivers them with great intensity, and all the people listening to him
Yeah.
are thinking, "Oh, I'm just so attracted to him," and then they find that if they actually meet him, he
Yeah. Yeah.
pulls away.
Huh. Interesting.
And I'm talking about men more because I think it's more been schizoid men that I've had personal connections with because I'm a heterosexual woman, so I'm sort of interested in that dynamic. But you can see it in schizoid women as well, and schizoid women have told me that a comparable thing happens to them.
Hmm.
Either if they're gay, it happens with other women. If they're not, it happens with men.
Hmm.
You know, where
So is
they
it
feel there's a hysterical undertone to them somehow.
right? Right. So would you, I'm not sure if I'm understanding it correctly, but would you then say that what they kind of defending themselves against, they kind of manifesting in this unconscious way? So schizoids, they don't want all that seduction and attention and feelings and attachment, but they're doing it to other people through this kind of unconscious ways, I guess.
Yeah, I think that does happen sometimes. I wouldn't generalize about it to everybody,
Yeah.
but yeah, I have seen that.
Hmm.
Makes Jung look pretty smart.
Yeah.
And
Yeah.
interestingly, schizoid psychotherapists tend to like Jung. They often like Jung more than Freud because the issues that Freud was concerned with have to do with desire and competition, and those aren't the central issues for schizoid people. Jung captured with his introversion extroversion idea captured something much more central to the world of schizoid people.
Yeah, definitely. So maybe if we kind of come back, because I feel like we started going into very interesting things, but I wanted to talk about you more about development of someone with schizoid personality. So you said before that potentially someone with schizoid is born with this hypersensitivity and tendency to get overwhelmed, overstimulated. So if there were, if you kind of could summarize the developmental journey, what sort of obstacles do you think they face in childhood, for example, and then adolescence until adulthood?
Yeah, I think the main problem for them is being easily misunderstood by other people who aren't schizoid. If they have a parent who is schizoid, they have a much better time than
Right.
if neither parent is schizoid, because what happens to a schizoid baby, infant, toddler, is they get pushed toward people, you know,
Right.
and that makes it worse. And their parents are always telling them essentially, "What's the matter with you?" And so, on top of their already sensitive temperament, which isn't always easy for them to manage, they are shamed and felt and made to feel like there's something wrong with them. And that gets all tied up with their self-concept. I'm a weird person. I'm not normal. You know, schizoid people can be really high functioning, so there's nothing abnormal about it, but it's a minority of people in this culture anyway, in Western cultures.
Yeah.
In some Eastern cultures, I think there's more of a tradition of the solitary monk or the person who spends a lot of time in thought, who speaks from the heart, but Western cultures have really elevated the idea of the person who gets along with other people, who's a good sport, who's fun, who plays sports, all things that aren't necessarily the most natural thing for schizoid people. So they get, first of all, a temperament that can be difficult because they're intense and sensitive. And so it's harder for them than some babies to calm themselves down. And then they get told there's something wrong with them. And then as they get older, they don't know how to formulate what's different about them. One of the things that several schizoid people have described to me is if your way of soothing yourself is to just go inside your head or go where you can be alone, you don't have to use distorting defenses like rationalization and acting out and reaction formation, isolation of affect, all the things that many people use who don't have the capacity to just go inside their head and feel all alone and okay there. So they tend not to understand those defenses in other people. They tend to see more things going on than many other people do. So it's as if they're saying, well, obviously there's an elephant in the room. And it's obvious to them, but if it's not obvious to other people and they get treated like a weirdo, then they start thinking it's dangerous for me to say what I see. Maybe I'm wrong. So then that further undermines their judgment. And they're not people who can be phony easily. They don't quite understand a certain kind of self-deludedness. I have a friend, a psychoanalyst, who says he really doesn't like treating people with neuroses like obsessive compulsive problems, hysterical problems, phobic problems. He likes to work with psychotic patients because they're honest. They're suffering and they're telling him how they're suffering. They're not pretending they're not suffering. So I was just so struck by the idea that conventionally neurotic people who use certain kinds of defenses are, in his experience, dishonest rather than defensive in a way that's easy to identify with.
Mm. Well, whereas with schizoid people, it's maybe more natural, more authentic, although I would imagine it's still difficult to share and open up to people because why would you trust them?
Very, very. And therapists have to learn to wait and to help the schizoid person feel relatively safe, that they can share what's going on in their internal world, which may be peculiar. I mean, maybe they spend all their time thinking about the end of the world, or some weird sexual preoccupation, or video games, and they don't expect that to be acceptable. So you kind of have to keep welcoming the person to talk about what he or she really is preoccupied with.
Yeah.
Schizoid people tend to make very good therapists themselves because they are very sensitive. They read other people well. And they, like all of us, let me backtrack. The Diagnostic and Statistical Manual is not only sort of mistaken in presenting the externals of schizoid people, they get the internals wrong. They make this artificial distinction between avoidant people who are conflicted about relationship and schizoid people who just don't want it. And that's crazy. I mean, we're all social animals that attach. And it's true that you can have such bad experiences that you give up on trying to make a connection. But originally, we all wanted to be close. And if you're working in therapy long enough with a schizoid person, their natural wish to make a connection is going to come out.
So you think that schizoid, like using this DSM terminology, so do you think the schizoid and the avoidant personalities is one and the same thing?
No, I think there are other ways of being avoidant. A lot of people who are phobic, who are very frightened of certain things, who want to stay at home, for example, who have agoraphobia, perhaps. That's a kind of avoidance, but it's not schizoid.
I see.
They don't have the same rich inner life.
Right. So the avoidance are more about this fear and anxiety. That's why they avoid activities and going out and doing things, maybe, or other people.
Schizoid people are sometimes misdiagnosed with social anxiety, and it's not exactly the same thing as with other people who describe themselves as having social anxiety. They do have anxiety. They have terrible anxiety about, being taken over by other people, being fooled by other people, being devastated by other people. But it's not, I'm going to look bad in company. They often don't really care whether they look conventional or not, as I said. They're not trying to fit in. They're trying to find their tribe or their person with whom they can fully be themselves.
In thinking about that idea of healthy schizoid, based on what you've been saying, it sounds like there's a lot to separate the the things to change about yourself or to work on, such as the shame and all these
Mm-hmm.
years of being misunderstood, versus your own maybe introversion and sensitivity that needs to be accepted.
Yes.
So I would imagine on this path, it's kind of difficult to sort out which parts of you that you need to kind of heal or fix or change, and which parts to embrace and live with.
Yeah, definitely. I guess it's not entirely different from anybody in psychotherapy trying to figure out what isn't changeable, that they simply have to accept about themselves and grieve and compensate for it as best they can, versus what they might actually be able to change. That's hard for everybody, I think, perhaps
Yeah.
especially for schizoid people, because the dominant culture doesn't give them the message that
Yeah.
it's fine to be a kind of a loner.
Yeah. I would imagine such a person needs to go a little bit against the current,
Yes.
against what's normal, quote unquote.
Yeah, Susan Cain wrote a nice book a few years ago called Quiet. Do you know that book?
I think so, yeah. On
It says
introverts.
something about the value of silence in a world where people can't stop talking.
Yeah.
You get
Yeah.
the sense of her, I'm not diagnosing her at a distance, but you get the sense that she has the same kind of sensitivity that most schizoid people have, that, too much noise coming at her is too much.
Yeah.
And I do think that, a minority of babies, they react to sound, to changes in balance, to changes in light, to tone of voice. They react to smell. I mean, their senses are just, it's as if they're thin, their skin is thinner than other people.
Right. Right. And if we take a step back, what are your thoughts on adult development? Like how adults, do we stop developing after adolescence, or do we
No,
keep?
I hope not. Because if I stopped developing in adolescence, we wouldn't be having this conversation. I
When
think
it comes to our psyche, yeah.
every developmental phase comes with its challenges. And, the one I'm challenged by now is figuring out, what I want to pass on now that I'm in my 70s, and how to make choices about the things I want to do, since there's a very clear frame around the coming end of my life. And all my friends of this age talk about a similar phenomenon, that wasn't quite real to us until usually mid-60s. It wasn't quite real that it really was going to end, that nobody gets out of here alive. So that's a huge developmental challenge.
Right.
The unconscious doesn't like the idea that it will stop going on being. And I've treated a lot of people who, like, when they retired, they didn't know what to do with themselves because they didn't know how to adapt to the challenge of shifting their work. So I think at every life phase, and I suppose Erickson was the person who tried to map this originally, there is adaptation that you have to do. It was partly a wish, I think, that psychoanalysts used to emphasize that if you had a really good early few years, or at least got through adolescence okay, you were probably fine. And there's some truth in that. You certainly are more resilient if you've had a very good start. But we know now that trauma can destroy anybody. You send a really happy, healthy, forward-looking, contributing person off to a war, and they come back an addict, a person in constant post-traumatic stress, a person who's lost all hope, who's suicidal and depressive. You can ruin people with what happens to you after adolescence.
Yeah.
So, we all have certain amounts of solidity. Personality doesn't tend to change over the lifespan, but you deal with your personality in better or worse ways.
Mm-hmm.
I think schizoid people generally tend to get more comfortable with who they are as they get older. Adolescence is hard for them because there's such a pressure on being in a group and being acceptable to a group, and
Yeah.
people with unusual interests are thought of, they tend to be bullied or at least ignored. Yeah.
Right. Right.
That's
Whereas
a
then an
tough one.
adult, they have more autonomy, more choice, so they don't have to engage in this dynamics anymore.
Yeah, and their colleagues in life as adults are interested in their being a little bit eccentric or
Mhm.
creative. Really, what I think the main thing that got me interested in schizoid psychology was that I fell in love with a couple of schizoid people, my first husband and who died about 15 years ago, and my second
Sorry.
husband both considered themselves in this group. And a couple of my beloved teachers and supervisors did. So I kind of came to this more through a deep wish to connect with these people who are kind of prickly to connect with.
Yeah.
I have noticed that with my own schizoid patients, it takes a while to develop a sense of real safety in the relationship. But whatever they were complaining about when they started, whether it's anxiety or depression or relationship problems, they tend to feel better about that once the therapeutic relationship seems solid. And I have to start eventually worrying that they've made the relationship with me, because here they can be fully
Right.
themselves, a substitute for taking the risk of seeing if they can translate that to the outer world. Often they came to me because they felt conflicted about pursuing a life partner,
Mhm.
and they feel better and better in therapy, and I suddenly think, wait a minute, they haven't done anything about that life partner thing that they came to me for. And I find myself having to push them a little bit.
Mhm.
Why don't you try just talking to somebody you don't know this week, and come and tell me how it goes. And you start really small, maybe a
Mhm.
little like exposure therapy. But yeah, the avoidance um, of relationship can get in their way later
I
in life.
see.
Although I have to say, um, schizoid people love deeply, and when they have kids, they love them deeply, and they often credit their child with pulling them out of themselves, uh,
Mhm.
and then later their grandchildren.
Mm. Yeah. So here there are all these experiences of high sensitivity and capability for, I suppose, very deep relationships and deep love and hyper awareness of certain things. And then on the other side, schizoids are perceived as this cold and aloof people who have nothing going on really.
Yes, yes, and that's just a projection from people on the outside that, um, oh, they're acting cold. If I were
Mm,
acting that way, it would be because I didn't care,
right.
not because I was so overstimulated that I had to pull back.
Yeah. Yeah. And
I've been able to help some mothers of little schizoid girls or boys, um, by telling them just to pull back and let the child come to you. And they're so surprised the child does eventually come to them. They have
Mm,
to give the kid the space to do it. They're always, what do you need? What can I do for you? Or why don't you do this? And that's that just makes it a lot worse.
yeah, yeah. So that sensitivity, hypersensitivity seems to be a major challenge for people with schizoid, it sounds like, in
Yeah,
dealing with it, managing it.
yeah. And some of them, I would say, there are two different, and there's some empirical data on this too. There seem to be two different types of parenting that are associated with schizoid psychology. One is parents who push the kid to have no dependent needs. You know, go play outside, go play by yourself. You were playing by yourself last week. Don't bother us with your dependency needs. So that will reinforce the schizoid kids feeling that their wishes for attachment are somehow unwelcome, crazy, primitive, babyish.
Mm-hmm.
That's one version. Um, Another version that I think is a little bit more common is where you had a parent who was all over you,
Right,
um,
the
who
opposite.
was controlling, intrusive, suffocating, and you couldn't get enough space from him or
Mm-hmm.
her. And that will create the same conflict about closeness, only in this case, um, the desire for it is hard to find in yourself because so much of your effort is just getting out from under.
Right, so these are two very extremes. You're saying like it's not very balanced, not very, a little bit of this and a little bit of that, but it's either this or that
Yes. Yeah.
when it comes to parenting, right?
Yeah. Another thing that some schizoid people have told me is that they felt their mother was very depressed and their
Mm,
sensitivity got kind of unconsciously exploited by the mother, where it created in the child the sense that the reason other people are trouble is
mm-hmm.
that they're needy and they'll put you in a state of obligation to take care of them, and there won't be room for you. So
Right. Yeah,
there,
I remember you wrote about this kind of hypersensitivity to people's feelings and emotions.
yeah, yeah. It becomes difficult in psychotherapy because some patients are so attuned to the therapist. I mean, some patients treat the therapist as sort of, okay, you're the professional. I'm going to tell my story and I'll wait for you. But my schizoid patients, they tune right into what I'm thinking and feeling, often
Mm,
with a stunning accuracy.
mm,
Um, and I think it's hard for them because
yeah,
they're doing all this extra work trying to figure out where I am.
right, right,
And I'm feeling a little bit invaded by their level of sensitivity.
right.
Mm.
But I would imagine it's not something they can control.
No.
It's just
And
can
and
shut it down.
anybody in a relationship with a schizoid person has to appreciate that about them.
Yeah, yeah. Okay, I know we don't have that much time left, so thought I'll ask you one last question. Because I know that a lot of schizoids, because of the isolation and maybe struggling to be themselves, and because of this sensitivity and not knowing what to do, how to function in this world with, so much pressure to be in this one particular way,
Right.
which is quite contradictory to their temperament and what they
Right.
want. They end up they can end up in quite a dark place where, everything is pointless, meaningless,
Yes.
where it's just kind of empty, or as they call it, it's like a void
Yes.
place where there's not much going on anymore. Would you have any advice for this kind of people? one thing that they could do to start changing that state for themselves?
The only thing I know to recommend is psychotherapy, but they have to be very, very careful to get a therapist who understands them. They are not people who can have a manualized treatment applied to them.
Right.
I mean, maybe they have some symptom that will respond to that, but that's not where they live.
Yeah.
They really need to first have an experience with another human being where they can elaborate who they are in the presence of another person. And
Yeah.
once they can do that, they can take that as reason for some hope that if it could happen with this person, it might not be hopeless. I
Yeah.
might not be falling into the eternal void.
Right. So I suppose finding the right therapist. The only issue is that, and I hear it over and over again, that for many people with schizoid personality, they finally reach out to someone, they do psychotherapy, they do therapy, and they just end up being disappointed. I suppose they find the wrong person for the job, but lots of them, they end up just being skeptical that therapy can do anything for them. So
Yeah, it's hard to know what's going on there. In
yeah.
some cases, it may be that they're so sensitive that they're protecting the therapist's feelings and not going back and saying, hey, this doesn't feel like it's working for me.
Mm-hmm.
You have to be able to do that with a therapist. If therapy's going to move forward, you have to be able to say, I didn't like that session yesterday.
Yeah.
You may have had good intentions, but it felt lousy what you said, and I was hurt by it, and here's my reaction. I think schizoid people easily withdraw even in the therapy setting rather than hurt somebody's feelings.
Yeah. It's very scary to say that, the therapy is not working. Yeah.
Another thing that might be possible is a group. Many schizoid people kind of like being in groups. You'd think that would be counterintuitive, but if it's a group where there's no pressure on them that they have to talk a lot,
Mm-hmm.
they can be around people. They can have the predictability of a relationship to several other people regularly. They can feel close to them because people are disclosing in the group without quite the pressure that you do in a one-on-one situation.
Mm-hmm.
And I think that's often a very good situation for a schizoid person. If they can't, if they don't want to find a therapy group, sometimes an Alcoholics Anonymous group is helpful to them, even if they don't have a substance use disorder, because people are
Right.
trying to be honest
Yeah.
and they're, regular and dependable and they have
Yeah.
decent values.
Yeah. And would you say when it comes to like individual therapist, finding an individual therapist, would you say there are any maybe signs to look for in the right person for someone with schizoid? Like let's say a schizoid goes to a therapist.
I think they should not stick with any therapist who they don't feel is emotionally authentic. If somebody is playing a role with them, is having trouble admitting that maybe he or she made a mistake,
Mm-hmm.
is suggesting a treatment before the schizoid person has really said enough about their inner world, that's a
Yeah.
bad sign. I mean, they have really good radar for people who are honest and genuinely caring. and they shouldn't stick with somebody who can't admit to a mistake or who has an agenda.
Yeah. So I guess kind of trusting themselves and their own evaluation of the situation of a person.
Yes.
That would be the biggest thing, and noticing how authentic the therapist is with them.
It does take time, though. I mean, it really takes time.
Yeah.
And it must be terribly disappointing if you put in the time, if you're a schizoid person, trying to be open with somebody, hoping that they will really get who you are. And then it turns out they don't. That would be pretty devastating. And unfortunately, schizoid people often have histories of trying to take steps toward people and then feeling traumatically disappointed.
Yeah, which just reinforces the whole idea that they should just stay away from others.
Yeah.
Okay, Dr. McWilliams, I think we covered most of the things I wanted to ask you about. I wish I could just keep talking to you because I had a whole list of questions, but it's been very nice to have this discussion with you. Is there anything else you would like to add to our viewers? Anything important that maybe we missed?
Only that if you have this kind of psychology, recognize that it's not necessarily such a bad thing. It's not easy.
Yeah.
But but you have more potential creativity than most people. You see the world in a slightly different way from most people, and we need you, the rest of us.
Thank you so much.
You're welcome.
Thank you.